let's start today with the anatomy of a femur. So this is a femur bone. This is its anterior view. This is its posterior view. This is a femur. So this is the long bone, as you all know. So this is the femur. This is the head. This is the neck. This is the lesser trochanter. This is the greater trochanter, and between these is the intertrochanteric line. And over here, this is the fovea is present over here. Then this is broken from here, but here is present a intertrochanteric crest, and over here is present a quadrate tubercle. Over here is present a gluteal tuberosity. Then this is the linea aspera. Linea aspera has this one is the lateral lip, this one is the medial lip of the linea aspera. This is the medial surface, this is the lateral surface, and this one is the anterior surface. Then see here also you can see this is the lateral lip of the linea aspera, and this one is the medial lip of the linea aspera. Then coming to the lower end, this is the medial condyle. Over here is present a adductor tubercle. This is medial epicondyle. This is lateral condyle, lateral epicondyle. Between this is present a intercondylar notch, and here is present a patellar surface for articulation with the patella bone. This triangular area present over here is the popliteal surface. This is the lateral supracondylar ridge. This one is the medial supracondylar ridge. In diagram also you can see here is present a lateral epicondyle and a medial epicondyle, and this is the triangular area is the popliteal fossa or popliteal surface is present. Then it is the bone of the thigh. It is about 45 centimeter and the longest bone. General features, it is a typical long bone. It is the upper end hota hai. It has shaft and lower end. Articulation, the head articulates. This is the head of the femur articulates with the acetabulum of the hip joint, and the two femoral condyles articulate with the tibial condyles, and the patellar surface articulate with the patella forming the knee joint. Then coming to the next part of the femur, that is the upper end. See, this is the upper end. This is the upper end of the femur. It is the head. This is the neck. This is the greater trochanter, lesser trochanter, intertrochanteric line, and this is the shaft. There is a neck shaft angle. You see, this is the neck and this is the shaft. So this angle is known as a neck shaft angle. Then coming to the posterior aspect, over here is present the quadrate tubercle. This is the trochanteric fossa, and this one is the lesser trochanter. See, this is the head. This is the head, forms more than half a sphere and directed upward. थोड़ा ऊपर की तरफ होता है, forward होता है, and there is a depression. इसे fovea बोलते हैं, and ये attachment देता है round ligament को. किस attachment होता है? Round ligament. In living or in humans, the head is covered by the hyaline cartilage and articulates with the acetabulum. Then coming to the next part, this is the neck. This is the neck of the humerus. This is the neck. It is about 5 centimeter long. See, and it forms an angle of 120 degree with the axis of the shaft. That is a neck shaft angle. This angle allows the free movement of the femur from the pelvis, and it is females, and in females it is smaller due to the larger size of the pelvis. Coming to the greater trochanter, this is the greater trochanter. This is the greater trochanter. A quadrangular eminence. See over here, you can see it is a quadrangular eminence which projects laterally and upwards at the junction of the neck and the shaft is the greater trochanter. Lateral surface carries an oblique ridge. Its medial surface carries a depression called trochanteric fossa. So here is present a trochanteric fossa. Then lesser trochanter, it is a small pyramid. See, lesser trochanter, small pyramid for the articulation, which lesser trochanter is a small projection which lies posterior-medially at junction of neck with the shaft. At junction of neck with the shaft is the lesser trochanter. Then the intertrochanteric line. This is intertrochanteric line. This is intertrochanteric line. It is a rough line. See, you can see it is a rough line joining the greater and the lesser trochanter anteriorly. Then intertrochanteric crest is present over here. A round ridge connecting greater trochanter and a lesser trochanter posteriorly. And it also, see, greater trochanter and lesser trochanter को posterior side से connect करता है intertrochanteric crest, जहाँ पे quadrate tubercle भी present होता है. Then coming to the next point, that is the shaft of the femur. So basically this is the shaft of the femur. See, it is convex forward. Here you can see it is a convex forwards to throw the line of to carry the body weight, and its middle one third has three surfaces, while upper and lower third have four surfaces. Middle has only three. Middle one third of the shaft, it has three borders. That is a posterior border, medial border, and a lateral border. Posterior border, this is the posterior border, that is a continuation of the linea aspera, and it has three surfaces: anterior surface, lateral surface, and the medial surface. Then coming to the next point, that is the linea aspera. So this is the linea aspera. See, it is present on the posterior side, and diagram also you can see this is the linea aspera. See, this is actually the medial lip, and this is the lateral lip. It's a broad thick ridge forming the posterior border in the middle one third of the shaft. Upper one third of the linea aspera extends, forming a spiral line which winds around the medial aspect, and the lower one third of the linea aspera, that is the medial and lateral lips of linea aspera, diverge from each other, forming the medial and lateral. See, like they come like this and they diverge, forming the medial and lateral supracondylar ridge. In this area, they form the lateral supracondylar ridge and a medial supracondylar ridge. Then coming to the upper one third of the shaft, this is the upper one third of the shaft. It is flattened posteriorly. See, it is flattened posteriorly, having a posterior surface. The posterior surface is bounded laterally by the gluteal tuberosity and medially by the spiral line. This is the spiral line, and laterally by the gluteal tuberosity. The pectineal line of the femur is a rough line on the posterior surface. Then coming to the lower one third of the shaft, this is the lower one third of the shaft, has also the posterior surface called popliteal surface. This is the popliteal surface, which is bounded by the medial and the lateral supracondylar lines. Then coming to the lower end, this is the posterior surface. It has an intercondylar notch and a line, lateral epicondyle, lateral condyle, and popliteal surface, and this is the lateral supracondylar ridge. Same on the side is present a medial supracondylar line. Over here is present adductor tubercle, medial epicondyle, and a medial condyle. On the side here is present the patellar surface for articulation with the patella. Then coming to the medial epicondyle. So this is the medial epicondyle. It is larger and more curved as compared to the lateral, and it projects more downwards. See, here you can see it is more downwards, नीचे की तरफ ज़्यादा है. Then coming to the lateral condyle, small, thicker, strong होता है, and project करता है forward, project more forwards as compared to the lateral one. And below the lateral epicondyle there is a groove called popliteal sulcus. See over here is present popliteal sulcus. Then muscles and ligaments attach to the upper end. This is the head. So over here is attached a piriformis. Here it is attached gluteus minimus. This is the vastus lateralis, vastus medialis. This one is the vastus intermedius, and the fibrous capsule is attached like this to this. This is the fovea. Round ligament is attached in it. And the iliopsoas is attached to the lesser trochanter. Coming to the posterior rib, this is the obturator externus is attached over here. Gluteus medius, quadratus femoris is attached here, and this is the pectineus. This is adductor brevis, then adductor magnus, gluteus maximus, and vastus lateralis. This side, vastus lateralis. That muscle attached to the shaft of the femur. This is the shaft. This is the vastus intermedius, which is attached, and vastus lateralis. Over here it is attached. See, this is the vastus intermedius. Here it is vastus lateralis. This is vastus medialis. Coming to the linea aspera, here is attached pectineus, adductor longus, adductor magnus, and biceps shorthead, adductor magnus, gluteus maximus, vastus lateralis, and quadratus femoris. Coming to the lower end, these are the articularis genu are attached, and this is the patellar survey, and capsule of the joint attaches like this to it. Coming to this side, here is attached plantaris, lateral head of gastrocnemius, medial head of gastrocnemius is attached on this side, and pubis part and ischial part of adductor magnus is attached to this side. So this was all about the muscles which are attached to the, and coming to the linea aspera, which gives attachment to the 9 structures. This is the linea aspera. It gives 3 insertions, that is adductor brevis longus magnus. 3 insertions, that is brevis longus magnus. 3 origins, vastus medialis, vastus lateralis, and short head of biceps. Then coming to the 3 intermuscular septa, that is medial intermuscular septum, lateral intermuscular septum, and the posterior intermuscular septum. That is linea. These are the all 9 structures which are attached to the linea aspera. 3 insertions, 3 origins, and 3 intermuscular septums. Then coming to the next point, that is the muscles and ligaments. We are done with that. Ligaments, that is the capsule of knee joint attached around the articular surface to the lower end of the femur. Tibial collateral ligament of knee joint attached to the medial epicondyle. Fibular collateral ligament attached to the lateral epicondyle. Anterior cruciate ligament attached to the posterior part of medial surface of lateral condyle, and the posterior cruciate ligament is attached to the medial condyle. Coming to the angles of the femur, as I told, there is a neck shaft angle, that is 120 degree, that is the angle between the neck and the shaft. Then the second angle is the angle of the inclination. It is the angle between the long axis of the femur and the axis of the tibia, that is 172 degree. Then the third angle is the angle of torsion. It is the angle between the long axis of the upper end and that of the lower end. It varies from 0 to 30 degree. See, 0 to 30 degree. That is angle of torsion. So this is all about the femur. Do like this video. If you want to refer my notes, you can even go on Instagram account, that is anatomy1803. Thank you for watching.